Okay, so the background of the issue for my final presentation was on nurses being short-staffed during their shifts or overworked, having too many patients than they're supposed to have on a shift. So the significance and importance of the studied issue on our nursing program, or I guess the problem of the issue, is the fact that honestly we get burnt out. We get burnt out from this. We start making more money than we've ever had before, and now we want to work extra. On top of that, we get too many patients, work too many hours, leads to burnout. And on top of that, on the patient side, there's too many issues to even count that could lead from care that's left undone, from patients, getting infections due to said care not being done. So the purpose of the study is to hopefully find a working model that helps staff nurses better. I know there's a ton out there, and I'm sure every facility does it differently, but regardless, I mean, I'm working in one of the top-rated hospitals in the country. It's in the top 50. I don't know. They probably all say that, but regardless, even our staffing doesn't work either. We're having to work double on calls. We're getting asked to stay later. It's exhausting. After a 13-hour shift of who knows what's going to happen, you get thrown more medications, more hygiene help, just more that you weren't expecting. That leads to frustration. So the research question I did was, in adults being admitted to medical surgical floors, what is the effect of short staffing nurses on recovery time and mortality rates of patients compared to those who are staffed appropriately? So in essence, we're just comparing like improvements overall with their stay and mortality rates to patients who are not getting adequate time with nurses to those who are. The theory I used was called the basic needs theory. It's built off of a pyramid. It has 5 different things. So the very bottom one talks about physiological needs such as air, water, food. We can handle that for 20 plus patients. That's obviously, maybe, but that stuff's pretty controllable. After that, it comes to like safety, which again, being in a hospital setting, depending on where you are, unless, maybe you're on the COVID unit, is pretty easy to control. But after that, we're talking things like emotional support, just a lot of the stuff that we really don't have time to do as nurses, a lot of times because of the amount of people that we have. So the literature review telling you the gap for studying this issue, I mean, I covered so many things. It talked about almost every floor, which was kind of nice about my subject when I was finding research, is that literally every floor, from PACU nurses to critical care to med-surg, NICU, you name it, everybody's understaffed, everybody's getting burnt out, everybody's tired of it, and we still haven't found a working model that really helps. So that was kind of my main focus. It's going to take a long time. It's probably only going to get worse for a long time. We're going to get underpaid for a long time. So, and I found so many studies that, talk about it and the importance of it, the infection rates, the mortality rates, and it's just getting worse. So clearly hospitals aren't driven by that. It's money.